Good afternoon, everyone. Thank you for joining us. I'm joined, as usual, today by the Chief Medical Officer and also today by the Economy Secretary, Fiona Hislop, given the substance of some of what I'll be talking about today. If I can begin with a daily update, as of 9 a.m. this morning, there were 322 confirmed cases of COVID-19 in Scotland. That is an increase of 56 since yesterday. Sadly, there are 6 people who have died, having been diagnosed with COVID-19. That is no change on the figure that was confirmed yesterday. Today, I want to start by sending my very best wishes to children across the country who are having their last day at school for what might be quite a while. I fervently wish that we were not having to close schools, but it is essential to help us reduce the impact of this virus. So I want to say to all young people across the country, as you finish school today, thank you for all your hard work this year. You are all an enormous credit to your schools and to your communities and, of course, to your parents. I also want to say thank you to all of our teaching staff and non-teaching staff in our schools and early years settings, and all those who are and will continue to be working flat out in our education service, both over the last few days and in the days to come, to help us adapt to what is a rapidly changing situation. I think the very fact that the Deputy First Minister confirmed yesterday that for the first time in our history there will be no exams this year underlines the seriousness of the situation that we're facing. So I want to take the opportunity today, because it is so important, to remind everyone of the advice that we are asking you to follow. Reduce your social contact unless it is absolutely essential to go out. That means working from home where possible. It means staying away from crowded places like pubs, restaurants and cinemas. If you're over 70, eligible for the flu vaccine because of a health condition, or pregnant, you should take that advice particularly strongly and stay at home as much as possible. And there will be further advice published later today for pregnant women in particular. If you show symptoms of a new and persistent cough or a mild fever, stay at home for 7 days. And if someone in your household is showing the symptoms, you should all stay at home for 14 days to ensure that you don't become infected and pass the infection on to others. And at all times, follow the advice on washing your hands, using tissues and avoiding touching your face. Now, I know that some of the sacrifices that we are asking people to make, and they are sacrifices, we are asking people to fundamentally change the way that we live our lives, that these will become more apparent to us and more difficult as we head into the weekend. I know that there will be some of you who might be wanting to head out to the pub for a final night out or looking forward to a meal out with friends, but my guidance to you is clear and crystal clear. Please do not do this. You must not consider this vital health advice to be merely optional. Now, let me say candidly and frankly that I know people don't like being told what to do by politicians. And in normal times, I might not blame you for not wanting to be told what to do by a politician. But please understand and believe me when I say that this is vital. It is vital for your own protection. It is vital for the protection of your loved ones, particularly if amongst those that are older or more vulnerable people. It's vital for the protection of our NHS and its ability to care for those who will need it in the weeks to come. It is vital for the protection of all of us, and it is vital to help us save lives. I want to thank all of those who have complied with this difficult advice so far. But again, to be candid, I do have a concern about younger people who I know will be disappointed not to be able to socialise with their friends over this weekend. And again, I cannot be clearer. Please do not think that this advice just applies to other people and not to you. As a young person, if you get this virus, there is no absolute guarantee that you will just have mild symptoms. But even if you have mild symptoms, you still risk passing the infection on to people who are more vulnerable. Please do not take that risk. Doing everything we can to slow down the spread of this virus now means that we will save lives and we will protect our NHS. We cannot just carry on as normal. Life right now is not normal. Now, I recognise that this guidance, the advice that we're asking people to follow, is already having a very severe impact on certain industries, and we are working and will continue to work with the UK Government and others to do as much as we can to address that. There is disruption for businesses right now across the economy. This is an unimaginably difficult time for businesses and for employers and for those who work across our economy. My message to businesses, large and small, is that we know this is difficult. We know times are hard, and we will do everything we can to help you. Early this morning, I chaired a Cabinet subcommittee of my economy ministers to discuss the government's economic response. We've already made £2.2 billion available through business rate support and grants. In the coming days and weeks, we will be expanding what is called our PACE system, which helps those who become unemployed into alternative jobs. And we know that there are sectors right now, the supermarket sector, who are expanding and seeking to employ more workers. We will also use our procurement systems and government contracts to keep financial support flowing to companies, and we'll be asking local government to do the same. And we're looking across our transport system and key industries to identify further actions that we can take. We've welcomed the support that the UK Government has announced so far, but we are pushing them to do more to help people. And I'm very hopeful that there will be a positive and substantial announcement from the Chancellor later today. We've called on the UK Government to put substantial support toward helping companies pay wages and keep people in jobs. It's essential that the Government takes action to put money into people's pockets. Whether that's through the tax system or national insurance, it is the biggest non-health intervention that we can take now to support society through this crisis. More help is also needed for those who are self-employed or on temporary or 0 hours contracts, who might not get the full benefit of other UK measures if support is provided through tax or national insurance systems alone. And as we do everything we can to help business, and we are determined to do that, business also has a role to play in helping us take on the challenge of this virus. So I'm asking businesses to treat your workers fairly and to respect the health advice. Don't make your employees come to work when the health advice says they should be in isolation. And don't make them come to work if they can work more safely at home. Everyone, of course, thinks that their staff should be defined as key workers. I understand that, and some, of course, will be right. But if your staff can work from home, then you should let them do that. Finally, I want to thank the vast majority of people who have been sensible in their shopping habits this week, and also to the supermarkets who have taken steps to ensure that supplies get to those who need them, particularly the more vulnerable members of our communities. I know that some people have felt the need to stockpile certain items, but my clear advice is do not do that. There is no need to do that. If everyone remains sensible in their shopping, then there is more than enough to go round. Supermarkets and pharmacies will remain open and supplies will continue to get to them. And while it's tempting to get everything from the supermarket, your support for local businesses at this time can also be a lifeline to them. So before I pass on to the Chief Medical Officer before taking questions, let me stress again my key message today. This has been an unusual week for all of us, and I think that is a gross understatement. I want to thank all of you who are already making big changes in your lives as part of the national endeavour to slow down the spread of the virus. But I cannot stress this enough. All of us, as we go into this weekend and beyond, need to follow the guidance. It is there for the protection of all of us. Let's not look back in a few weeks and wish that we had done more to protect ourselves and to protect each other. The time to act is now. I'm going to hand over to the Chief Medical Officer, and then I'll open to questions which I, the Economy Secretary and the Chief Medical Officer will be happy to address.
Thank you, First Minister. As we are on the cusp of a rapid acceleration of cases of coronavirus in Scotland, we have seen increased numbers day on day in the past week or two, and we also have evidence of sustained community transmission across Scotland. That has led us to introduce these difficult measures. We've gone in a very short period of time from asking people with symptoms to self-isolate to adding people's whole households isolating, to adding vulnerable groups, older people, and then the schools closing from today. And these have affected many, many people already across Scotland, myself included. My 2 children went off this morning for what is their last day at school, possibly for my eldest daughter for the last time. So it's not something that we have taken lightly, nor is it something that any of us want to be standing here discussing. All of the scientific advice tells us that these measures will be effective to slow the spread of the virus, to prevent many people becoming so sick that they are admitted to hospital and sadly dying because of the disease. But the measures will not be effective if people don't comply with them. The percentages, the modelling has looked at the numbers of people we need to do these measures very rigorously in order to stem that spread of viral transmission. If people don't comply, they really do, as individuals, make a difference to our country. They risk not only their own health, but the health of those around them, the health of our vulnerable groups, and also the risk of our capacity in the NHS, having too many people to be able to care for them in the way that we would wish. We've talked a lot about our older people, but our younger people have responsibilities here too. While the vast majority of people will have mild symptoms, around 80%, we know that even in younger people, they can become significantly unwell. There are risks to all of our population across Scotland. The good news is, though, that if we do comply, these measures have been shown to be effective. They're difficult. They really do require a long period of time to be fully effective. But as a responsible citizens across Scotland, I know that people will want to protect themselves and others. And if you do comply, if you do listen to the advice, for all of us difficult, but we will make a difference. We will slow the spread of the virus. We will save lives. We will protect the capacity on our NHS.
Thanks, Dr. Cogwood. Yes.
If people don't follow this guidance, does it make the likelihoods of a complete lockdown, does it make that more likely to happen? And on the other hand, if they do follow the advice, do you agree with Boris Johnson that we could be over the worst of this in 12 weeks' time?
Well, let me take both of those, and Dr. Calderwood might want to add on the latter point in particular. Can I say firstly, I don't particularly find it helpful to use words like lockdown, because I don't think people really understand what that means in practice. But there is absolutely no doubt, we've said this all along, that we will keep the measures we're asking people to take, and whether there is a need for additional measures, under ongoing review, and we will be guided by scientific advice as we do that. I am saying very clearly, it should not be assumed that what we are asking people to do now will not become even stricter and more difficult in future. We have said previously we don't currently have powers to order the closure of pubs and restaurants. Of course, the emergency legislation published yesterday delivers additional powers to governments across the UK, and we will consider responsibly using those if we think it is necessary. And I come back to the final point here, and the most important point of all. I do not relish standing here asking people to do the things that I'm asking them to do. I don't relish standing here as First Minister talking about the blanket closure of our schools and the cancellation of exams. I never anticipated, and certainly would never have wanted as First Minister, to be in this position, and I'm sure I speak for all leaders across the UK and indeed across the world in saying that what we're asking people to do right now is essential, it's vital, it's for their protection, the protection of their loved ones, the NHS, for the protection of all of us. So I hope, and anecdotally my impression so far is that people in the main are trying to do the right thing. And if we all do the right thing, then these measures will make a big difference, as Dr. Calderwood has said. On the timescale, I certainly hope that Boris Johnson is right. And in that kind of timescale, we get to a point where we think we have turned the corner. I also, though, as I'm sure he does, want to be candid with people. None of us, certainly I don't feel, and I said this when I announced the school closure policy earlier this week, I cannot stand here and say with certainty right now when we will be in a position of opening the schools again or lifting these measures. We want that to be as soon as possible. But what I would say is that the greater the compliance with what we are asking people to do, then the greater chance there is of getting through this in a shorter period than we would otherwise do. And given the uncertainty around the timescales, I believe what is most important for me as First Minister is to share as openly as possible the information, the advice and the analysis that I have with the public so that we can go on this journey together. And as I become more certain of some of the things I am not certain of right now, I can make sure that that is passed to the public as well. Do you want to say more, Catherine, about the timing?
The certainties that we do have are the cases increasing again and again in Scotland, and us continuing to count those. We have the measures in place and will monitor the effect that that they are having. I think that scientific discussion about 3 months' time for these measures, if they are working well, possibly then the peak is lowered. If they are working less well, then unfortunately the measures would have to last longer, or, as the First Minister has said, become more restrictive. It's about our own data in the UK. We're looking at it daily. I don't think there are any certainties in this progress of this disease anymore.
Okay. Yes, Mark.
Been looking at the testing figures and the data, and it's shown a big spike when we first started testing, and then it kind of starts to level off. This is percentages of positive tests. Now, from what you're saying, I know that doesn't tell us that this is levelling off. But what is that chart telling us? It seems to have levelled off around about 3-4% of the people who have been revealed as being tested. What's that graph telling us? And secondly, you mentioned young people can get very sick as well. You know, this isn't just a disease of old people. There's reliable reports from abroad about children and babies getting very sick and even dying from this. I mean, is that a message that you want to send?
I'll now take a little bit of time explaining the data point. So up until we talked about people who were symptomatic self-isolating, we were testing everyone with symptoms, we were contact tracing their contacts and following them up. The numbers we knew would seem to plateau or even reduce when we stopped testing everyone with symptoms. So we're in a transition phase still, where our community surveillance is not fully covering as we will get to, but we've stopped testing everyone with the symptoms suggestive of coronavirus. So unfortunately, I can't read anything into that figure that you're quoting of it appearing to slow down. I'm guaranteeing you it is not slowed down. It's this transition of the community testing and having the proportion of people within the community, that testing fully covering those numbers. You're absolutely correct then on your second point about younger people. So while the most vulnerable are those people who are elderly, over 70, people with underlying medical conditions, actually this disease affects everybody across the age range. It's just that lower numbers, lower proportion of younger people will get very sick and die, but it doesn't mean it doesn't happen. And it also doesn't mean it doesn't happen in babies and children. Very small numbers of babies and children, but people in their 20s and 30s, fit and healthy, do get this coronavirus very severely and can be significantly unwell with it.
Colin.
When you look, you've recently said you're a few weeks behind Italy. When you look at what's happening in Italy now, and you see other European countries going for a lockdown, are we failing to catch up with the other European countries? Are we being left behind on that, and are we going to face something bigger as a result of that than we could be?
For reasons you'll understand, I'm going to hand over to Dr. Calderwood pretty quickly in this answer, because she obviously will give you an answer based on the science and the advice. What I would say as First Minister, and from my perspective, is that while we can't make this virus go away, we have always known that, there is nothing inevitable in us, to use your phrase, becoming like Italy. That will be down to whether or not we are successful in ensuring compliance with the measures that are all about slowing it down, reducing the peak and reducing the peak pressure on our National Health Service. And that, I suppose, really gets to the heart of and underlines that message to the public. This is a deeply anxious and worrying time, but none of us are powerless in the face of this. Each and every one of us, through our own behaviour, can make an impact on how quickly this virus spreads and how many people are infected and over what timescale. And so if we look at what's happening in other countries and want to see that be different here, then that's what makes it so important that we take the action that we're asking people to take. But Dr. Calderwood will give you more of a perspective on where we are relative to other countries.
Thanks, Colin, for your question. It's very clear that across the UK the situation is not the same. The numbers of cases and the evidence of community transmission is very much concentrated around London. So London is not even the same as the rest of England. And we would be here in Scotland probably behind in our numbers of cases accelerating than even the rest of England. So we are watching the numbers in London very, very carefully, and we have not got that sustained transmission to the same extent in Scotland yet. Which then brings me to reiterate the fact that the measures here, if we can suppress the spread of the virus, perhaps we can slow that community transmission and slow that explosion of numbers of cases that has been seen in other countries and that not yet in London, but may come to that. So again, the measures having been introduced very rapidly, multiple measures affecting almost everyone, if not everyone, if we can comply with those, perhaps that rapid acceleration can really be slowed as those measures are designed to do.
Yeah, I'm going to appeal to businesses to treat workers fairly. We've seen from the Coronbridge Hotel near Abbey Moor what's happening there. It's left to workers say that's because of government advice, and we know of other hotels possibly making similar decisions. What would be your response to what's happening near Abbey Moor, and what would be your advice to other hotels?
Well, I would unreservedly condemn the approach that was taken in the Aviemore case. That is not how we want employers to operate. I don't underestimate and wouldn't try to downplay the difficulty that businesses and employers are in, but we've seen so many good examples, and McDonald Hotels, of course, stepping in here to offer accommodation to those affected by that. So we want to be doing everything we can to support employers and businesses, but in turn we need employers to support their workforce too. But I'm going to hand over to the Economy Secretary to say a bit more about this.
So clearly the national endeavour to get us through the health crisis is going to require an unprecedented economic response, shared collectively, deliberately and with purpose by business and government and public. The example you've just given of the Coronbridge Hotel has been condemned by the rest of the hospitality industry, and the Scottish Tourism Alliance in particular have made that clear. So what does that mean that we see? Some of the experience we have just now will bring out the best in people, and some of it will bring out the worst in people. The prime issue just now has to be on people's health. Employers must allow their staff to follow medical advice, to isolate themselves, or indeed as part of their households, and workers shouldn't feel pressured in any way to breach that advice. We have to put the public health aspects first and foremost. But we know there'll be economic consequences, and that is why we need to make sure we've got a comprehensive economic framework that covers a whole variety of different areas. How do we keep productive capacity in the system? For industries that may, for example, in hospitality, have to hibernate for some time, how do we make sure that we keep that capacity going? And possibly in some instances there'll have to be step downs in economic activity. But as part of that, we have to protect employees, and this is the situation I think you're addressing. And that is why we need to have some kind of system, and that's why we're looking forward to hearing what the UK government may say this afternoon in relation to keeping people in employment with some kind of income support. And if everybody, that's business and government and employees, work together, that's part of that shared endeavour that will help us get through what is an unprecedented health crisis.
Okay, any further questions? Yes.
Transport providers have indicated they're going to have to possibly cut back on some of their services. Are there any possible interventions the Scottish Government could do to support these key routes?
There are, yes, and we've been discussing that at the Cabinet Subcommittee this morning that I referred to earlier on. Yesterday, and I know I'm going off point on transport here, but yesterday I announced that The money that the government provides for early years education, for state-funded places and nurseries, will continue, even although children might not be at the nurseries. Now, there are other forms of support, for example, to the bus industry that government provides, and we're looking across government at where we can keep the support going, even although the services may not be being provided, or at least not provided to the same level. And we're looking across transport at that, as well as across other areas of the economy where we provide that kind of support. Michael Matheson is the responsible Cabinet Secretary here and is looking at buses, support perhaps for the rail industry, as well as the wider transport sector. We are very aware that just as with pubs and restaurants and cinemas, the leisure and hospitality and tourist trades, the advice that government is giving is reducing and in some cases extinguishing the demand for these services. And as I would say in terms of the overall approach here, when government is asking people to make such fundamental changes that fundamentally change the way we live our lives, it is incumbent on government to also make sure that they step up and have an unprecedented response. We will do whatever we can within the Scottish Government. I'm not saying this in any party political or government tension sense, but many of these levers right now do lie with the UK Government. I think they have responded well in the announcements they've made so far, and I'm very much hoping that we hear further positive announcements in that regard from the Chancellor later. Agnes.
We've obviously seen in Italy that doctors have been having to make some really difficult choices, and we've seen some reports here that GPs are asking patients to have conversations about how far patients in different categories might want treatment to go, and we know that doctors are having to think about that already as well. Do you think patients and families should be having those conversations about how far they want treatment to go?
I'm going to hand over to a doctor in a moment, because I think these conversations are always best, or these questions are always best answered by a doctor. I'll just make the obvious point that I made earlier on. While we face this crisis and we can't make it go away, nothing is inevitable about the scale of it. And it comes back to this point, we can all have an impact on this kind of thing if we do the right things now. And I can't say that often enough. People are feeling anxious, they'll be watching this. You can all help. Stop us get into these situations by doing what we're asking you to do now. But I'll hand over to Dr. Caldwell to answer this from a medical perspective.
We have in Scotland been having realistic medicine conversations and encouraging that for many years. The reports that I have written have been very widely received, not just in Scotland, but very positively across the world, because we want people to be involved in decisions about their care. Setting aside coronavirus, that's the right thing for people to do, to discuss their needs and their wishes and to discuss what would be the right thing for them, something that's right for one person, not right for another. And we have been, I think, very transparent about some of the downsides of some of our healthcare and the burden that healthcare can put on people, particularly if they have a limited time to live. Those conversations are happening here. They were happening before December. The fact that GPs are now encouraging that, I don't think that would ever be seen to be a bad thing in a healthcare system. The difficult decisions that you're talking about being made in Italy, no doctor, no healthcare professional of any sort wants ever to have conversations that are really at that critical level where actually there isn't enough healthcare. And therefore the measures we've introduced, the way that we would like the Scottish population to respond, and perhaps actually is it maybe more important that Scotland complies with these measures because we haven't got that explosion of cases, and maybe the measures working as they're designed to work can actually prevent some of what we've seen in other parts of the world. And perhaps because we are behind that acceleration in Scotland at the moment, is it not more important that these measures are taken seriously and that everybody here in Scotland can do their bit?
Okay, any final questions? Okay, yeah.
We just have one other question from somebody who'd been in touch with the BBC whose urgent cancer operation had been cancelled, and a few patients in Glasgow had the same thing. Is there changing of priorities around that?
Sure. Look, can I say I made a similar comment in Parliament yesterday. We have, by necessity, again, it's one of these things we don't want to have to do, said that we will have to postpone non-urgent elective procedures in our National Health Service. We have been absolutely clear that cancer treatment, emergency treatment, urgent life-saving treatment must go ahead. So rather than comment on specifics that I've not seen, and I would say this, I made this point to another journalist the other day, you have an important scrutiny role to play. People will go to the media. I understand that, and I'm not complaining about that, but this is not a normal political situation. So please, if people are coming to you, these are people we want to be able, if we can, to help and to give good information to. So make sure we've got the details of that so that we can respond as quickly as possible. Okay, if there's no further questions, can I thank you all for coming, and I'll see you all soon.